to the channel. This is Dr. Olush again. I want to share with you guys my personal hormone replacement therapy story. I mentioned it in a few videos that I was going to get to it, but then in the interest of time, I didn't get to it. So I'm like, you know what? Let me just make a video about that, and then I can tell you guys to go watch it so you can hear my story, okay? So, why in the world did I, at the age of 31, start replacing my hormones? I know, I said 31. You guys are like, huh? I'm 56 and I'm scared to take it. Why did you start taking it at 31? Okay, so let's talk about it. All right, so welcome to Angelic Live Wellness. If you're new here, I definitely want you to click the subscribe button. We talk about hormone, weight loss, aging gracefully, caring for your skin in the most natural ways, all in this channel, okay? We have also a free VIP group in the school app where I'm able to go deeper into some of these topics, talk about things that I cannot talk about on YouTube because, you know, we don't want to get canceled. If you're interested in hearing some sauce, okay, make sure you click and subscribe, okay? So, today's topic, my personal hormone replacement therapy story. So I started learning about hormones after medical school. I know, I learned in medical school too, okay? So, but we learned the basics, right? How the menstrual cycle works and, you know, men's testosterone and the biochemical structure of hormones. We learned all that. Yes, I agree. But to go into it a little bit deeper, when I finished my internal medicine training, I went and spent 2 more years learning about hormones. Because I realized what powerful chemical messengers these are and why we cannot ignore them, okay? I talked about that in some previous videos, so I won't go into it again here. But after learning about this during this 2-year time frame, I kept asking myself, well, I'm in my 30s. Should I be worried about that right now? Or do I need to wait till, you know, the advanced maternal age, you know, beyond 35 before I worry about that? So out of curiosity, I had my attending doctor at this time ordered the lab work for me so that I can check my levels. And I got the blood work back and we reviewed the results and I was shocked. My hormone levels at 31 had already started dwindling. And I was like, what in the world? So I'll give you an example. Testosterone. Okay, so women have that too, for those that don't know, okay? So we have testosterone, estrogen, progesterone. Those are 3 big hormones that come out of our ovaries. So when we got the lab result back, my estrogen was fine, my progesterone level was fine, but my testosterone came back on the low side, actually significantly low. And I started thinking about, wait, I did notice that I had some of those symptoms that low testosterone caused, but I didn't think that I would have that problem this early, so I never blamed it on testosterone. I just kind of, you know, blamed it on everything else. Well, life is stressful. I'm in medical school. I just had a baby. I just, you know, have to deal with balancing the practicing medicine and being a mom and being a wife and full-time job and being on call and overnight shifts. And so I kind of just blamed it on everything else, like the symptoms that I was having, because, you know, life was busy. So, you know, I just blamed it on those busy things. But when I got the hormone level back, it all made sense. I was like, yes, I was having those night sweat things, but I just thought, you know, it was hot today, maybe. And, you know, I was having a little bit of, you know, brain fog, I called it, you know, libido, you know, I would lie and say I had a headache every now and then, you know, like, you know, most women do. So we just cover that one up, you know, and so on, right? So it was like one symptom or the other, and I just find an excuse for it, and I just kept it moving. But when I got the result back and I saw that my levels were where I would have expected my 60-something-year-old to be, I was like, okay, so we need to do something here. And so at the time I asked my attendant, like, okay, should I just let this be? Like, isn't this considered early to be replacing hormones? And the answer to me at the time was, well, just like we've been learning this last 2 years, you can start experiencing the symptoms now and they just get worse with time. Or you can take what you've learned from here, apply it to yourself and see if they really do work. And that makes sense to me. I said, well, I am experiencing the symptom. My lab work just confirmed it. And if I really think about it, if I look at my family history, it was staring at me in the face all along. So why am I not doing something about it? Why do I want to suffer for the next 20 years just to get to this random number of 50 years that we say women should go into menopause before I start addressing this problem that we have now identified? So what I decided to do, and this, I'm not saying this is the option for everyone, what I decided to do was put this to the test. I decided to go ahead and replace my hormone, my testosterone level at this young age. And when I looked at the options that were available to me at the time, I picked to use the plant-based bioidentical hormone. And I actually used the option called the pellet method. I don't know if any of you are familiar with that, but a pellet basically is the size of a grain of rice. And it is when the testosterone is extracted from the yam or the soy, it's in the form of a powder. And that powder, we can then compress it under high pressure to the size of a grain of rice. And now I can take that grain of rice and slide it under my skin, and it will start dissolving slowly from there every day. For some patients, it could last 4 months, some patients 3 months, some patients 5 months. It depends on how your body actually uses this hormone up, like what's going on. You're stressed, and, you know. So there's a lot of factors that determine how long the whole pellet lasts. But that was the method that I decided to use. And what I noticed within the first 2 weeks was, it was like my brain just all of a sudden could focus better. Like this thing that I was calling a brain fog, it was like it lifted. And I started noticing that I had a little bit more energy. Like normally maybe, you know, I had my full day of work, I'll get home maybe 7 o'clock at night. I'll be kind of winding down to where I was already kind of tired. I sometimes would talk myself out of working out, going to the gym, going to a walk, because I was just like, oh, you all know what I'm talking about. I just want to get that couch, you know. But I noticed that when I got the hormone replaced, like I wasn't getting tired at that 7 o'clock. I actually had enough energy. I wanted to go out and walk or go to the gym or go do something else. Or maybe tidy up the house a little bit more, and, you know, and it was just like I had my energy last longer into the day. So I noticed that. Then I also noticed an increase in my libido where I wasn't having to say no so often. Climax was more enjoyable. Okay, let's not get too graphic, but you get what I mean. So I started noticing those things improved only because I optimized this one hormone. And what that did for me was that it helped me to realize that if that happened to me at 31 and I was already feeling those things and I could feel the benefit of it at that age, how much more is my patient that has had a couple more decades of dwindling, and they're now in their 50s or 60s, and they've never had this hormone replaced. and how much more brain fog, and how much more fatigue, how much more joints aches and pains, how much more belly fat problem, and so on are they gonna be having, right? So it became clear to me that this is something I definitely have to start checking in my patients, not when they get to 50, but early. So in my practice, when my patients come to established care with me, I'm like, I want to know what your baseline is. I don't care if you're 25. Like, we need to know where you are now when you're at the peak, right? The best hormonal balance time of your life. Because now I have a number that I know, well, when you were functioning, when everything was great, you had energy, you had like to get up and go. What was that number that you were at, so that we can use that as the number that we're going to target in the future when you now need hormone replacement, okay? So my story is kind of like, yes, I was not yet at that menopausal age before I needed hormones, but I have been replacing it since that age. And I'm telling you that a lot of women that have decided to replace their hormones, they can share their testimonials about how it's helped them feel like themselves again. Yes, you're gonna have the patients that hormone therapy is not appropriate for. I agree, and I think that it's important that we definitely point those out, right? Because if I have certain genetic risk factors, like things that promote blood clots in my body, for example, or if I'm a smoker, or if I'm currently dealing with, let's say breast cancer, for example. Okay, that is a higher risk group, and we really have to have that one-on-one doctor-patient consultation to really figure out, is it appropriate in this person? Is the risk for this person higher than their benefit? And we really have to make that decision together as a team. And you have to understand that you are part of this decision-making process. You don't want someone that's just going to prescribe hormone to you without explaining why it's beneficial for you in your particular situation, and also have a follow-up plan. How are they going to measure it to make sure they're not giving you enough, too much or too little? What are the markers that they're looking for? What is the goal target numbers? All those things has to be discussed so that you are getting the best result for you and reducing your risk. Hope that story helped you. I'm still on hormone therapy and I plan to continue. Okay, so if you have any questions, comments about this, if you think I started too early, why am I staying on it? Why don't I let nature take its course? Please make a comment in the section below. I would love to read those, so maybe I might need to explain a little bit further about a different aspect that I might not be seeing. I'll see you on the next one.